it's a matter that is dear to my heart and that many of you know I've been very passionate about for many, many years. And I think yesterday that we all saw in the paper an item that affects every lives of every person in this room, and not only this room, but our county, our cities, and also our region. And that basically is the new proposal by Ballad for trauma centers in our region. You know, many of us were somewhat surprised, although many of us also knew that this was probably coming. Okay, this process for some time has been somewhat almost secretive. You know, there really hasn't been a great deal of public discussion, and the public has not been made aware, in my opinion anyway, of what is at risk. And I would just like to, if I may, share my opinion, having been involved with emergency medicine here for over 30-some years, okay? And also having been involved with the volunteer aspect and the other side of it from the emergency services side, and helping to develop not only our emergency medical system here in the county, but also some of the trauma in our region. So if you will permit me, I would like to make just a few comments, okay? To me, I think it was a sad day yesterday when we learned that Ballad was going to basically name one level 1 trauma center in the region and sadly downgrade the other trauma centers in their region, okay? The people of our region really need our trauma centers. I think all of us realize the importance of these trauma centers. It's been well proven that these trauma centers save lives, they reduce mortality, they improve outcomes. That's only if these people are able to receive definitive care within 60 minutes of the injury. I think all of us have been heard of the golden hour of trauma. This is extremely important. Timely access to care is critical for these trauma centers to actually do what they need to do, okay? Rural trauma still accounts for almost 60% of all trauma deaths, okay? These trauma centers, well, in our area, access to timely care is very difficult to achieve, okay? I think all of us who have lived here for most of their lives realize that this geography or topography makes it difficult, even by ground transport, to get from one place to another to these trauma centers. So if we start to eliminate some of these trauma centers, we start, in my opinion, to decrease access to care, okay? And we certainly decrease timely access of care. There's been a GIS study which basically shows that the zone of optimal survivability, that's that 60-minute time period. You look at the people that live within or without that period. That zone of optimal survivability significantly decreases if either one of those level 1 trauma centers should go away, okay? What that means is basically more people live outside of that zone, and those people risk their lives, okay? I think that all of our trauma centers are extremely important in providing the people of Sullivan County the access to quality care that they need. But you know, I think that most of us would agree that when we are choosing a life-saving, time-sensitive service for the people of our region, that most of us would probably think that you would look at which center is best located, most capable of providing the highest quality of care to the most people in the region. It kind of makes sense to most of us, okay? I personally don't think that that decision was made for that reason, okay? I think that there was other reasons in deciding to do that. You know, I think the level 1 trauma center in Johnson City, in combination with the perinatal center in Johnson City, qualifies Johnson City Medical Center to be a safety net hospital for the state of Tennessee. For those of you who are not familiar with that, there's 6 safety net hospitals in the state of Tennessee. That qualification basically means millions of dollars in Medicaid funds from the state of Tennessee to Ballad Health, okay? It's obviously very important, and obviously Ballad probably cannot afford to take the risk of losing that level 1 trauma center. Some of that's pretty understandable, okay? But what happens then if you put a trauma center in an area that maybe doesn't best serve the whole region, okay? Don't you have an obligation to try to look at what it does to the remainder of your service area and to the lives that are affected in that? And but quite frankly, I believe most of that service area, the people's lives are affected. You know, I think you look at basically a small area from Johnson City, Washington County, Carter, and Unicoi that aren't affected. But the rest of the Ballad service area is significantly impacted. impacted by this decision. Why in the world, though, would you downgrade a level 1 or a level 2 trauma center to a level 3? To me, who have been involved with this for many, many years, I simply don't understand, okay? You know, there are basically 3 levels of trauma center designation in the state of Tennessee. Number 1, the level 1 is the highest level that's out there, okay? It has the highest number of requirements. Level 2 is very similar to a level 1 requirements, but then there's a level 3. The level 3 basically is the lowest trauma center designation in the state of Tennessee. The level 1 and level 2s, by definition in the state, provide optimal care. The level 3 facility, and I quote from the state definition, says a facility providing maximum trauma care commensurate with community resources. The level 3 facility generally serves communities without all the resources usually associated with a level 1 or level 2 facility. A level 3 requires far less of the hospital and only minimal specialist availability, okay? Now, I started to try to go through some of these requirements and to basically list what it requires. But let me just try to make it very simple here. A level 1 trauma center in the state of Tennessee requires basically 28 different specialties to be involved and available 24/7. A level 2, which is Bristol Regional, okay, is very similar and can actually deliver, in my opinion, the same life-saving capabilities as a level 1. A level 2 facility has 24 requirements for specialties availability. Then we look at a level 3. A level 3 requires four specialty availabilities. Ladies and gentlemen, that's a heck of a decrease to go from a level 1 or a level 2 facility to a level 3 here in the region. You know, I'm not sure. You know, I certainly have my opinions, but I believe that the folks who are making these decisions believe that by adopting a level 3 facility recommendation at Bristol and in Kingsport at Holston Valley, that they basically think because of these minimal requirements that they will no longer have the need nor the responsibility to provide physician on-call pay, nor to provide locum tenens coverage for specialists who are no longer or not available to cover the on-call roster. That means lots of money to that organization. It's costly to do that. But in my opinion, it's far more costly not to have this capability available. Okay? I think that the cost to the people and the lives in Sullivan County, Kingsport, Bristol, and all of the region will be affected because of this decision here. You know, successful trauma programs are very difficult to develop, but it's very easily to destroy. You know, I think that both over the last 30 years, the programs at Bristol Regional and Holston Valley have created wonderful and tremendous life-saving capabilities. Are those going to go to waste now? Okay. What do we expect to happen with those things? Okay. Let me kind of explain to you why this is so very, very important. The state of Tennessee has destination guidelines in effect. Destination guidelines are rules that require that certain patients with certain vital signs or with very specific injuries must be transported to a level 1 trauma center if that level 1 trauma center is within 30 minutes unless it is refused by the patient or overridden by medical control. So what that means is for people in Kingsport, if there is a car accident on Stone Drive right below Holston Valley Hospital, and that particular person in that accident has a blood pressure of less than 90, that, ladies and gentlemen, is a level 1 trauma patient, okay? That person is now going to have to be, by regulation, transported out of Kingsport to Johnson City, the level 1 hospital over there, okay? I personally do not think that that really is acceptable, okay? You know, I think all too often that we take things for granted. You know, we have been very blessed to have wonderful life-saving facilities in this area for the last 30 plus years. We've also been very blessed not to have had a major mass casualty incident or a disaster. But we should not really forget the Cherry Hill tornado in Kingsport, the Vico tornado. the Eastman explosion, and very recently the near disaster in Tennessee Eastman. If these precious resources are allowed to dwindle and go away, then when that mass casualty incident or that major disaster does occur, we no longer will have those resources capable and will not be able to handle those. You know, I personally do not believe that reducing the level 1 trauma center in Holston Valley or the level 2 hospital in Bristol is justified. I believe that the far better alternative is to basically to maintain the level 2 hospital in Bristol as a level 2, and also to try to maintain the level, which is Holston Valley, since it will no longer be a level 1, at least a level 2. As we said before, the difference between a level 1 and a level 2 is very minimal and able to provide very similar capabilities in the saving of lives. I think that we could then petition the state of Tennessee basically to allow an exception for Northeast Tennessee, an exception that would allow level 2 facilities in Northeast Tennessee to accept level 1 patients. It should be acceptable because all of these trauma centers are now owned by the same hospital, and I believe that we could be successful in doing that. You know, what that would actually do is it would basically provide a solution that would save lives. It would preserve our valuable regional resources. It would prevent economic fallout in the affected cities. It would maintain the safety net hospital status in Johnson City. It would meet COPA requirements. And most importantly, it would prevent dangerous and unnecessary patient travel in most of our area. Certainly important to all of us. You know, I basically appreciate all of you guys' involvement. I know the Board of Mayor and Alderman in the City of Kingsport had a meeting and with the folks from Ballad Health, you know, and so I think that it's important that the folks that are representing the people in our communities have some voice and at least be given the opportunity to express an opinion. I think your public has the right to be able to hear some of these discussions and to get involved and at least make some suggestions and stuff.
Dr. Spivey, I guess as a matter of form, I've got to say you've gone over your limit
a
little bit.
I sure have.
But I don't cut anybody off.
I apologize.
No, you're fine. I just wanted to be consistent.
The only thing that I was going to add to this is that I believe that this suggestion for a potential solution is not anything that you guys can vote on. I understand that, okay? But in my opinion, when you're dealing with lives, it's probably better to be a little bit slower, a little bit more conservative, get adopted something like this, and if it doesn't work down the road, this can be revisited. If it's not successful for Ballad, it can be revisited. But on the other hand, if we go with the current plan that's been offered by Ballad, and it proves unsafe to the patients in their area, it will be extremely hard to go back from a level 3 to a level 2. So I guess that I would just like to say that I believe that the people in our region basically deserve to have the very best chance of survival if they're faced with a major traumatic event. I think for the last 30 years they have had that, and I don't think that they deserve any less today. So I appreciate you listening to me. I would make myself available to answer any questions that anybody might have if they would like afterwards, and I thank you for allowing me to address the community.